For many women diagnosed with cancer, radiation treatment can bring an end to their chances of having children. But a groundbreaking surgical procedure developed at Baptist Health's Miami Cancer Institute is offering new hope for preserving fertility. Dr. John Diaz, who is the chief of gynecologic oncology and medical director of robotic surgery at MCI, which has treated many Bahamian women, performed the first uterine transposition surgery in the United States on a 32-year-old patient.
The treatment for most GYN cancers is a hysterectomy or pelvic radiation, which is really effective in treating the cancer, but has the side effect of eliminating the possibility of future fertility. And so for young women who are dealing with a cancer diagnosis, but also trying to preserve the fertility, this isn't a good option. And so my patient was 32 years old. She was diagnosed with a vaginal cancer, which the treatment for that would be radiation therapy, for which we could cure her of her cancer, but it would have eliminated her ability for future fertility. And so it's our patients that demand us to do better.
The procedure temporarily moves the uterus and ovaries out of the radiation field, protecting them from damage. It's a major advancement for young women battling colorectal and gynecologic cancers.
So the uterine transposition surgery is where we move the uterus outside of the pelvis. We move it into the upper abdomen, where it's going to live during the patient's radiation therapy. And then at completion of radiation therapy, we move it back into the pelvis. And we do this actually with a very similar technique that we would do for a hysterectomy. The difference here, obviously, is we're not removing the uterus. And so we want to preserve the blood supply to the uterus through the blood supply to the ovaries. And we know from our previous experience with radical trachelectomies that this can sustain the uterus and sustain a pregnancy. And so it's really important while you do this, you follow the same surgical principles you would for a hysterectomy, again, maintaining that blood supply. Once you detach the uterus from its attachment to the vagina, you want to be careful not in any way to injure that blood supply, because you're going to now tag it to the anterior abdominal wall where it's going to live during her treatment, and then move it back into its normal anatomical position.
Carried out using robotic surgery, the technique minimizes pain and speeds up recovery. Dr. Diaz hopes to train more physicians to use the procedure and says the feedback from the global medical community has been encouraging.
So it's really important that we reach out to the community of doctors who aren't even aware this is an option, the community of patients, so that they can ask their physicians to see, are they candidates for something like this? And since we've begun this campaign to educate physicians and patients, I've gotten numerous phone calls from colleagues across the country and across the world asking, how do you do the surgery? Can you walk me through it? I have a patient to send you. And we've already performed 2 of these procedures at our health system. And so any woman that thinks she might be a candidate, or any physician that thinks their patient may benefit from this, can certainly reach out, and we'd love to treat more women with this and preserve their fertility.
He says many of the cancers seen in young women are linked to HPV and stress the need for prevention and early intervention.
And then this is a human papillomavirus, which is transmitted through contact, usually sexual contact. And this is what accounts for most cervical cancers, most vaginal and vulvar cancers. And this is the disease that we should be able to eradicate. Through HPV vaccination and through cervical cancer screening, we should be able to eliminate these diseases. And so while I'm happy to innovate and I'm happy to come up with creative strategies to treat women, the goal is to not have to do these things. The goal is to prevent these cancers from ever developing. And so we need to do a better job of educating physicians, parents, and patients about the benefits of the HPV vaccine, try and work to eliminate some of the myths or maybe some of the concerns that patients have that may not be founded in actual true risks that are associated with this vaccine. We've had this vaccine for over 10 years. It's very safe.
Reporting for the Guardian News Network, I'm Voni Toot.